and the benefits and I won't say privileges, but yes, somewhat. So we are going to be talking about the difference between MRCPI and MRCOG. What is the benefit of doing MRCOG? And if anybody has finished their MRCOG or they are halfway through MRCOG, so can they switch towards MRCPI? So we are going to be talking about that. So yes, it is going to be a bit, the kind of overwhelming to some candidates because they are preparing for both exams. So it doesn't matter because I'll be highlighting all these things and I'll be telling you guys that how these exams differ and how these exams can bring a change in your the practice and a change in your clinical knowledge as well. Because somehow this exam is the more clinical rather than theoretical. So when we talk about this MRCPI, so yeah, we need to be, the thinking of all the time that they are not going to be so critical towards our, the exam preparation, and they are not going to judge on, the teeny tiny things that, how we have studied, what syllabus we have followed. Although we do have a syllabus, the in here as well. So we are going to be talking about in depth. Okay. So before I start and and go on to have a discussion, so before that, I would like to ask you guys is that what do you guys think of what MRCPI obstetrics and gynecology is, and why would you like to pursue this? And what do you think is the importance of this exam in your life? Have you guys, any of you have given any thought to this? That how you are going to go for this exam and why would you like to go for this exam? Anyone? So it would be a good idea to, to start having a positive discussion. And then, of course, I will tell you in my words. Yeah, anyone? Anybody can answer. Anybody can, the kind of take part in discussion. Mhm. So nobody wants to talk, yeah? Everybody wants to listen, yeah? So no problem. So, okay, so let's get started. So this is me, Dr. Zaib Qureshi, and many of you guys know me already. So, the candidates who do not know me, so let me just tell you that I'm Dr. Zaib Qureshi. I'm from Pakistan, and I have done a couple of, the exams. In fact, I have done FCPS from Pakistan, then MRCOG from UK, then MRCPI from Ireland and European Board, the EBCOG, EFOG as well. So apart from that, I have done, the couple of more certifications and everything. And currently I'm practicing as an OBGY specialist as well. So all the more reasons, the teaching is my passion and I do teach with, the all of my heart because I really want to spread knowledge. I really want to create awareness regarding, the multiple exams and how you can utilize one training into the so many exams. So this is a good idea that if you can the take the burden of the all exams, so yes, go for them. Okay, never look back, never listen to anyone that why are you going for this exam, why do you want to go for this exam. Every exam has its own worth, every exam has its own you can say the positive impact in your clinical practice. All right, so trust me, because as an overseas candidate, when we go through our training process or training or our own exams, so somehow we do feel that, I mean, there is a lack. Okay, there can be a lack of the clinical practice, there can be a lack in terms of that, the evidence-based management, because every country has their own the national or the local guidelines, and however we do follow some of the RCOG guideline in practice as well, right? So but when you go through all these exams, so your the thinking become very critical. You think in and you try to manage your patient in the lines of evidence-based management, evidence-based guidelines. And yes, of course, once you are going to go through all these exams, so you will change a drastic change in your personality, in your own the practice, the way you behave in your hospital, the way you talk to your patients, the way you bring any change in your the own practice. Okay, Because by the end of any exam, what is your ultimate goal rather than moving to any other country and seeking for a job or a better perspective, job perspective? But yes, I mean, all of us are doctors and all of us really want to be productive to our patients, isn't it? So always remember that by the end, we really want to, prove ourselves to be, the good doctors, to be helpful to our community, and to be, the kind of good addition to any place of work where do we want to work, isn't it? So yes, in today's session, we are going to be the main agenda for our session is going to be the introduction that what MRCPI is and how and why and the we have to pursue for this MRCPI and what change it is going to bring and what are going to be the job perspective. Although I'm not into that, the topic at the moment because I am teaching and I am trying to give you the complete overview about this exam. And later in the discussion, we are going to be talking about, the very beautiful topic from Irish Guideline 2023, management of rheumatic diseases in the preconception, antenatal, and postnatal period. So we will be, discussing all these things. All right. So first, we are going to be talking that what is MRCPI exam, why to take MRCPI, what are its benefits, what is its exam pattern, why MRCOG candidate should attempt it, and later on, we are going to discuss this guideline as well. All right. So what is MRCPI exam? So I'm sure all of you guys know that MRCPI is membership exam of Royal College of Physicians, Ireland. And it has got, the multiple specialties. So obstetrics and gynecology is one of them. All right. So why to take MRCPI? Of course, it's an international, the membership examination, and Irish, the Royal College is the oldest Royal College there is. Okay, because if you are aware of Royal Colleges all around the globe, so we do have UK Royal College, we do have, the Australia and New Zealand Ranzogi, then we do have Ireland, the Royal College as well. Yes, Dr. Bushra, you have raised hand. Any question?
Sorry, I have so much background noise. I just want to ask you
Mhm.
whether this exam is accepted in UK and this is for gynae exam. This is medicine exam.
No, 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 sweetheart. MRCPI has got multiple.
I'm thinking to give it because medicine.
Uh-huh. So are you from medicine?
This is for gynae specifically or medicine.
No, no, no. We are talking in today's discussion. Of course, this is for MRCPI, obstetrics and gynecology. Okay. However, they do have MRCPI in medicine, internal medicine, family medicine, and the rest of the specialties as well. Okay.
Okay. Then I will join that one. Thank you very much.
Okay.
Because for
Okay.
gynae, Shukran, thank you.
Okay. Okay. Fine. No problem. No problem. All right. Okay. So the MRCPI exam, why to take MRCPI? What are its benefits? So the benefits is going to be number one, an additional prestigious qualification in your, the qualification list, number one. Secondly, you are going to be member of Ireland. Third, you can move to either UK or either Ireland. Okay. Now, from 2023, they have started this thing that with MRCPI obstetrics and gynae, you can move to, the UK. You can get your GMC, okay? GMC is the license exam, licensing certificate, in fact, and then you can start working in UK. Because we all know that in UK, you need MRCOG or any other Royal College exam. So after that, of course, you can get GMC. But now with this MRCPI Ireland, either you can work in Ireland or you can work in UK both. But there is still, the gray area which needs to be addressed, or maybe in near future, that whether you can get, the enrolled later on in your, the training jobs or no. Okay, because mostly they do prefer their own local trainees. Okay, their own trainees, GMC trainees, and then they are going to be taking, the rest of the trainees. So, but yes, if we talk about that, whether you can work, then yes, you can work. Okay, and then what is exam pattern? And then why MRCOG candidate should attempt, to go for this exam. So MRCOG candidates already are studying. In fact, they are studying too much because, the syllabus is never ending for MRCOG. However, when you will have a switch to MRCPI, you will feel a gross difference. Okay, because the syllabus is not that vast, you have limited guidelines to go through. You don't have to study that much, you don't have to emphasize on numbers, you don't have to emphasize on percentages and all. So this way, this MRCPI looks, the bit easy. Okay, so the of course, you will have GMC, you will have the potential the jobs opportunities in Ireland and UK, and of course you can get into the final training before going through the individual practice. Okay, in MRCP I am talking about in Ireland. Then additional prestige, recognition of Royal College, and it is recognized by the UK as well, right? And because if you have done MRCOG Part 1, you can directly apply for MRCPI Part 2 exam, which is MRCOG Part 2 theory. You have more jobs, you have more doors to learning in competitive environment, you have addition to knowledge base and enhancement of the clinical practices. And of course, this is going to be a new feather in your medical achievement cap. Then why not being an MRCPI? Because its booking has a long time and less difficult booking procedure comparatively as compared to the MRCOG. Okay, so yes, you can work in UK, you can work in Ireland. Then what about exam pattern? So exam pattern is relatively easy than MRCOG, right? It has only one paper, 100 single best answers question. Exam is of 3 hours. It is held twice in a year. There is no negative marking. Okay. Since COVID pandemic, it's been online with remote invigilation. Okay. All you need is that you are going to the attempt this exam from your home, from your working environment. All you need is a stable internet and of course 3 hours peace. Okay, so relatively this exam looks very easy. However, because the competition is the tough, you have to compete with the brains all around the globe. Okay. Secondly, because of the bulk increase in the the demand of this exam, keeping in view that candidates are moving to UK with this MRCPI. One moment, please. And because the remote invigilation needs, the invigilators as well. So that's why they do have, the limited, maybe limited, the seats. So that's why they may have, the long wait, okay, for the exam. So keeping in view of this, at least if you are being, forwarded to this route to enter into UK or Ireland, so what you need to do is that at least, the once exam booking will start, so at least start your booking process. Okay, because once you will be in the queue, once you will be in the wait list, so at least if at all you don't get seat in this exam, so you can get seat in the next exam. However, you have to apply every time. Okay. So, the fourth is, like I said, that, the exams is going to be the twice in a year. Then once you pass your theory, you are going to be going towards your, the final exit exam, which is part 2 OSCE, and we call it as clinical. Okay. So clinical exam with real patients. Okay. OSCE, 7 active stations of the OSCE, 10 minutes each. Then there is going to be a one long clinical case, 25 minutes. So it is available these days in Ireland, UAE, and Oman, and yes, Saudi as well. Okay. So they do have increased, the numbers of centers these days because they really want to, because of increase in demand, right? Because so they are increasing the exam centers as well. Okay, so for 2024, they have had, the 4 exam centers. So they do divide that, for example, these 2 centers will be in the May date, these 2 centers will be in the, or these 2 centers will be in the November. However, Ireland will always be in the, the exam list. Okay, so Ireland also has, the two, the exam centers itself. One is in the Dublin and other is, I think, Merwick or something. Okay. So yeah, they do have, the two, the exam centers as well. Okay. Then requirements. There, this is another, the important questions which is frequently being asked by the candidates is that what is the requirement? So before you sit the MRCPI written exam, so you must have one of the following qualification. because this still is a beauty. So I must, they encourage and, they ask you guys to go for this exam, that so far they don't have, the part one for MRCPI. Either you have to have MRCPI part one, general medicine or pediatrics, if they obtained within the last 6 years, or either MRCOG Part 1. However, exemption from MRCOG Part 1 is not accepted. And even though exemption has been, they withdrawn long time ago, I think at that time, even I was not, the thinking of going for MRCOG. So I think they have withdrawn this exemption in 2007, if I'm not wrong, long, long, long ago. Or either you have to have MRACOG Australia or New Zealand, or FCOG South Africa, FCPS from Pakistan, the MR Renzogi, and then the Malaysia Obstetrics and Gynecology exam. So for overseas candidate, and the for the especially for the Pakistan candidate. So if you are FCPS from Pakistan, or any candidate all around the globe, if you have passed your MRCOG Part 1, so yes, you can be eligible for this MRCPI, the theory exam. Okay. So I think this is a good deal for the time being, that the candidates who have not the attempted for MRCPI, MRCOG Part 1. So the candidates who have this FCPS degree from Pakistan, so they can the apply for this exam. Clear everyone so far? Yeah. Any question up till now? Yes, guys. Any question?
No, ma'am.
Okay. Okay. Fine. All right. So after this, we will move to the eligibility criteria. Okay. So what is the eligibility criteria? Eligibility criteria is that at least you have to have, the from January 2016, they have had maximum number of times a candidates can sit any part of MRCPI exam, which is 6 attempts. It means you can sit for this exam 6 times. Okay. 6 attempts for theory and 6 attempts for clinical. So total 12 attempts in 2 parts. But you have to pass your part 2 examination within 6 years of your first attempt. It doesn't mean that you are going to drag this exam for long, 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 and you will sleep, you will wake up, you will, make up your mind, and then you will go for it. No. Okay. So you have to pass your, for example, if you have appeared in back in 2022 and you haven't appeared, the up till now, so it's a wise, the idea that go for it now. Okay, because the 2.5 year has already been passed. So, you have only, the 3 years left. Okay, so at least because you have to pass this exam, not only attempt. So this is a wise, suggestion from my side, that once you go for any exam, don't delay any, the next, the step. Okay. If you have passed part 1, try to pass part 2. If you have passed part 2, try to pass your exit final exam. Okay. Part 3 or clinical. All right. So then comes the entry criteria. So entry criteria, earlier they used to have 2 years, the training. But now they said, okay, 18 months of postgraduate training is enough. Post-registration, not graduate. Okay. Post-registration means that after your registration in your medical council. Okay. So at least 18 months is going to be enough to apply for this exam. 9 months should be in the obstetrics and 9 months should be in the gynecology or in the combined post. So usually, the almost every country has had this, the training, the kind of criteria. So we do see all type of patients in our training program. Okay, so the posts must be recognized by the Institute of Obstetrics and Gynecology at RCPI at least 6 months in duration and completed by January before the March exam. Okay, so it means anyone who wants to go for this exam and they are in their training process, so make sure that you have finished your 18 months by the end of this December. So then you are going to be eligible for March attempt, and by August before the September exam. So application of March 2 and 2025 will closes in due time, which is going to be 8th of January 2025. And for March exam, the still there is remote invigilation. So it means that, the important thing for this thing part is that places or the seats are very limited. Okay. So you may not get a place in this exam when you first apply. You will not be asked to pay the exam fee upon first application. If you are successful in this application, you will receive an email after closing date of the application with a link of the payment and confirmation of your place in the exam. Okay, so this is important. So if you have applied for this diet, for example, so please allow at least 2 weeks after the closing date of application to receive an update for the status of your application. So major difference between Mrcpi and Mrcpi booking process is that Mrcpi has, the thorough online, the work, okay? The seats will open, you will book your seat, and then you will go for this exam. But for Mrcpi, you have to wait for emails. Although they are very good, they are very responsive, they are very, in fact, responsible people. I really like, the Irish, the college, because they do reply on time. If you email them, they do answer your every query there is, and they do send their emails on due time as well. Okay, but again, make sure that you have everything ready, because all the more reasons we should be concerned about the fee. Okay, because of course fee is a lot. All right, so for this, the March exam is going to be on 6th March. It's still remote invigilation, and the booking will open on 4th of December, and booking will close by 8th of January. But make sure that you send your, the booking, okay, and you start applying for this as quickly as possible, okay? Because your application will be in the queue, and after this closing date. But in this process, don't stop studying. Don't stop studying. Doesn't matter if you get the seat this time, or doesn't matter if you don't get seat this time. Okay. So either way, you will get confirmation after 8th of January. So they roughly give 2 weeks window. For example, you can get seat after like 8th of January, then 8, 16, and then 24. So you will get somewhere between, 8 to 24 of January. But again, don't stop studying for this exam. Okay, continue with the same pace, study hard, and study smart. Make sure that you have your bank card ready to pay 730 euro. Okay, and plus not only 730, but yes, there is going to be an additional tax charges, bank charges, international transaction fees, and blah blah blah. So you can think of that. Yes, I mean it can be a bit more than that. All right, and results, once the 6th March is the exam date, and on 4th of April you will get the result. You can see that, how beautiful they give the timeline of whole year. These people are, they're so beautiful in terms of, all these things, planning and everything. All right. And if you will pass this exam, then you will have an opportunity to go for OSCE, right? So after March, you will get the chance in the May OSCE, maybe this time. Okay. Then again, idea remains same. If you want to be real, the quick, and if you really want to go through this exam so quick, so yes, you have to prepare right after you finish your, the clinical, the theory exam. Okay. So start studying for this OSCE, because then May OSCE is going to be in the Ireland, and then there is going to be the international venue, any venue. Okay. So they said it's going to be confirmed. All right. So, however, if any candidate is here, so there is an additional diet because of the increased number of, the candidates. So 21st and the 22nd February, it's in the Oman. The fees is a bit high because of the, the international venue. So if you want to go for Dublin, so the fee is going to be less, but then you have to bear the travel cost, hotel cost, and blah, blah, blah. But for me, Dublin has been a blessing because I opted for Dublin, and it was a very beautiful experience for me. Okay. It's a beautiful city. You can go sightseeing. However, it is expensive. So this way or that way, the things are going to be, I know the tricky in terms of finances. But yes, if you want to go for this exam, so make sure you are ready for everything there is, starting from preparation, duration, and of course finances. All right. Then, the what to include in your preparation. So when you apply for this exam, you need to upload scanned copies of the following document. Number one, attested copy of your primary medical degree, a recent color passport style photo, okay, with this, the resolution, a copy of your part one or equivalent qualification for MRCOG part one. You need official part one pass letter and make sure it is scanned. It is not a random picture from your phone, the camera. Okay, it should be a very high resolution scanned copy. It should be in PDF form. So once everything opens, so I mean, it's a wise idea that you upload all these documents. All right. So attested document should be there, your primary medical degree and the equivalent qualification. So it can be attested by anyone. Okay. But the here they say all these things, so don't need to go to them. You can get them, the attested from any of your consultant if there is any MRCOG, or if there is any MRCPI consultant, so you can get them, from them. The major issue is the translation, official translation, because the many countries, they do issue their own, the medical registration certificates and all in their local language. So they really want to the have the translated degree. So make sure if anybody has had any any degree in the other than English, so it should be converted into English document. Okay, the medical school degree, your the medical license, and then of course the experience certificate as well. All right, clear everyone so far? Any question?
No, ma'am. No questions.
Okay, okay, brilliant. All right, great. All right. Then how to prepare? Another, the important aspect. First of all, know your syllabus. Then make a good schedule. Okay, book slot according to your own feasibility and circumstances. Then prepare with the full throttle by not leaving any loophole. Practice as many questions as possible, because we all know that practice makes a person, perfect, right? So you have to practice SPAs. You don't need to be waiting for anything that, okay, somebody will post or somebody will bring or somebody will give me something and then I will prepare. No. All right. So we will talk again step by step. Know your syllabus. So we do have RCPI guidelines. So you just need to Google on the RCPI guideline, gynae ops. So I mean, a window will open. So the window is National Clinical Guidelines. Okay, RCPI, National Clinical Guideline, obstetrics and gynecology. So they are almost 20 plus, and still they are revising them. And I think recently they have had 2024, the one guideline. Okay, so they are revising it. So keep checking the website for latest update and the study. Then green top guidelines, you have to study 10 to 15. You have to selected TOG articles you have to study, but again of the clinical relevance. Selected BASH and the FSRH guidelines, hardly 5, or you can say the 6, then hardly the NICE guidelines. So altogether, you can say that it is even, the less than 50% of the curriculum of MRCOG Part 2. Okay. But yet again, because you have to, the go and scan and skim, the all these guidelines. So yeah, it can be a little bit overwhelming or cumbersome. But yes, since if you know your curriculum, if you know what to study from, if you know how to, the wise use of Google, trust me, you can't, miss anything. Okay, so yes, after this syllabus, what you need to do is, of course, focus guiding. So me as a, a teacher, MRCPI, so I am offering, the course on MRCPI for March 25 batch. So we will be having, the online sessions, almost the 10 to 15, exclusive SPA practice daily in the, the study room, recall discussions as well, focus on all salient points to pass this theory exam. Okay, so the course will start in November. and the fee is very nominal. And even if you want to join as the two friends group, so you can contact with my team members, so they are going to guide you. So this way, the I can help you as a teacher. However, we do run the free groups as well on WhatsApp and the Facebook. So do join them, according to your own feasibility. Paid groups are, the question arises, why paid groups again? So it all, the gives you a focus. So you will be committed to attend the classes. I'll be committed, or anyone will be committed to, they deliver the lecture, or to make lecture, the easy, palatable for the candidates. So at least you guys, out of the busy schedule, you can, listen to the lecture later on and extract the important points. Because, in the end, what is your aim? In the end, your aim is to pass this exam. Okay. So yes, you guys are welcome, and you guys are encouraged to, join me for the MRCPI sessions. However, if you are going for MRCOG exam, okay, for January, so you have 2 months, solid 2 months. So yes, you can go for this MRCPI theory as well. So it's not going to cost you, the anything. So I think it's a wise idea, because you are going to be in one flow. You can study, you can, I think you can pass these both exams. All right. So, I mean, it's all up to you. But yes, if you want to, avail any opportunity, so please, they do talk to my, the team members. Then comes, the after, the guidelines, the TOG hot topics. So RCPI usually is more clinical. Okay, so they do want to talk about the cases which we see on our day-to-day practice. Okay, I'm sure all of us do see the cases of amenorrhea, endometriosis, polycystic ovaries, labor, of course, and ovarian cyst, and they are obsessed with the ovarian cyst from the childhood to the menopause. Okay, ovarian torsion, ovarian cyst in premenopause, ovarian cyst in the adolescent, ovarian cyst in the postmenopause age group, ovarian torsion, and anything related to ovary, anything related to ovary or uterus. So they really want to ask, the all these clinical questions: hirsutism, hyperprolactinemia, Down syndrome screening, contraception, basic thing. So if anybody doesn't know what's the mode of action of CHC, if anybody doesn't know what's the mode of action of Mirena, so I think, the he or she, I mean, doesn't deserve to pass. Okay. So at least, the basic concepts should be on your tips. Okay. Basic concepts should be, the revised and revised, the every other day. HRT, the most importantly, the menopause and related issues, osteoporosis. So RCPI love, if you just look at these topics, you will see that they are pretty clinical. You don't have to go through much of the detail. You don't have to extract so much of theory from here and there. Okay, so you can just bring your own clinical knowledge. Just you can, the study the important TOG articles, guidelines, and then yes, you can crack this exam so easily. Clear, everyone? And this list is not like, I mean, this list is so exhaustive. So you do have, the many more, the other topics as well. Induction, all right, the CTG part, and then comes, the infections, maybe. Okay, out of infections, there are like 1 or 2 questions from HIV, syphilis, CMV, parvovirus. So yeah, we do have, the helpful resources available. So we will be guiding you guys in our free groups. However, we will be guiding in our paid groups as well. All right. So my, the fellow colleague, Dr. Rabia, she is going to moderate, all these sessions on daily basis. So you are encouraged to join. Then comes practice questions, single best answers. So we do have couple of, and yes, bad part, or you can say the sad part for this exam is they don't have any, the SPA practice book. Okay, so all the more reasons you have to do all MRCOG guidelines, but again, be extremely careful of the keys, because you have to answer every question in the lines of RCPI guideline, because all these, the books are on the MRCOG curriculum. Okay, so you just need to do the SBA part. Don't touch EMQ at all, because that is not your syllabus and that is not your domain. All right. Recalls are must to do. So there are plenty of recalls available from, if I'm not wrong, then from 2016 till 2024. So they are almost of 8 years. right? So yeah, you have to, do all these guys, the recalls again and again. You have to solve as many questions as possible, and then yes, you have to go for this exam. Okay, so we will help you as the team, and we can help, support, advise, and we can give you the focus guidance. All you need to do is that you have to put your hard work. You have to take this exam as seriously as possible, and you have to be thinking of all the time that yes, this exam has the equal appoint, the importance. Okay, so never take any exam as the exam of your the choice. Always think that okay, this exam is important for me. I'm going for this exam. I'm putting that much of effort. I'm putting the every kind of effort into it, starting from mental, physical, psychological, financial, of course. Okay, so go for any exam with full preparation. Okay, never go with half-hearted preparation. Never go with half-hearted the kind of thing that okay, I will just go, I will just attempt, and I will just leave. It shouldn't be like this. Okay, clear everyone? Any questions so far? Hmm? So I'm just trying to be as simple as possible, so at least it will be beneficial for all of you. So I presume that there is no question. So because it's a very easy thing. Okay. All right. Great. So we will quickly go through this, the RCPI guideline, and a relatively new and very interesting topic, the management of rheumatic diseases in the preconception, antenatal, and postnatal period. Okay. Like I said earlier, that they really want to talk up in the lines of the clinical aspects as well as the theoretical. So yes, they do bring the nice algorithms. They do bring the nice the guidelines that how are you going to manage and this and that. So the management we will see in the end. So before that, they say that the rheumatic diseases are diverse group of the diseases that commonly affect the joints, but can also affect the muscles, other tissues, and internal organs as well. Okay, so common types of rheumatic the and musculoskeletal disease in the pregnancy are okay these. So we do have rheumatoid arthritis. We all know the spectrum: joint pain, swelling, early morning stiffness, psoriatic arthritis, ankylosing spondylitis, juvenile idiopathic arthritis, systemic SLE, lupus erythematosus, the syndrome, and vasculitis, and Sjogren syndrome. All right. So all these musculoskeletal and rheumatoid and the musculoskeletal, the types can be seen in pregnancy. And of course, if anybody who is a known case of all these issues, so they needs to be addressed because pregnancy itself has its own pros and cons, right? Pregnancy can have some effects on a disease. The disease can have some effect on the pregnancy, and not to mention that the fetus as well. What is going to be the effect on the, the upcoming baby? So that is also important. All right. So we need to be thinking of all the time. Okay. So what is the outcome if the active RMDs are associated with the, the any outcome? So of course, active disease is going to be connected with worse pregnancy outcome. All right. So I'm sure all of you guys know that almost all autoimmune diseases have phases. They do have acute phase, they do have quiescent phase, they do have flare up, okay? And they do have, the active phase. So if anyone who has conceived in the active phase or flare phase, so the chances of having a flare in the pregnancy is a bit more high, and she can be at risk of development of so many complications, starting from complications for her own health and for the pregnancy and the upcoming baby as well. All right. So how do you give the preconceptual care? So preconceptual care is going to be broken down into pieces. Okay. So if somebody is coming to you, so you will take a detailed obstetric and medical history, you will do examination, you will send certain investigations. Okay. What medication is she on? Baseline urine exam, baseline blood test as well. You will assess the disease activity. You will check the activity and focus on achieving and maintaining good RMD control, pre-existing organ damage if there is any, lung, cardiac, renal, or something. you will, they look for, the any exacerbating agents. You will consider referral to the MDT. Then you will have a medication review, because many of the medications in the autoimmune diseases are not pregnancy friendly. Teratogenic medications, right? Like methotrexate, cyclophosphamide, mycophenolate, mofetil. So of course, they are considered to be the teratogenic, and so that's why preconception counseling is important. So what is going to be your exam question? So what are you going to do to reduce the, for example, fetal neural tube defects? So you have to put the patient on in the preconception care, zero point 0.4 milligram daily for at least 3 months pre-pregnancy and up to 14 weeks. And mind it, it is entirely different from RCOG. Okay, RCOG says 12 weeks only. And sometimes in the medical disorder, they give 5 milligram full dose folic acid. However, here they will give only 500 microgram. Okay, then 5 mg is going to be for the woman who is on methotrexate. Okay, sulfasalazine, who have high BMI. This was exam question this time. More than 30, the BMI, and who have had a history of neural tube defect. So you will start them on 5 milligram folic acid 3 months prior to conception up to 14 weeks of gestation. Counseling information, plus, the random and the general health, the issues, smoking cessation, alcohol discussion, the discontinuation, BMI should be healthy, screening for cervical check, rubella, varicella immunity, and vaccines. Then if she becomes pregnant, what you will do? At the time of booking, so booking will start for about 8 to 10 weeks of, the gestation. So she will be booked under the consultant-led care unit. At the time of booking, her blood pressure check will be done, urine dipstick will be done to evaluate urinary tract infection and proteinuria at each visit. Then you will start aspirin 75 to 150 milligram to reduce the risk of preeclampsia, risk in the woman deemed to have high risk factors such as hypertension, CKD, and from early pregnancy to 34 weeks of gestation. This is also different from RCOG. Okay, so you will continue till 34 weeks. Gestational diabetes risk factor should be evaluated, VTE risk assessment, referral to other MDT, fetal monitoring, anti-Ro, anti-La antibody. Okay, so for this fetal monitoring, you will send all women with anti-Ro, anti-La antibodies positive. So they require fetal heart rate monitoring every week from 16 through 26 weeks of gestation, because heart block will be there. Okay, and baby may die in utero and nobody will ever come to know about it. All right, and anti-Ro, anti-La, and Sjogren antibodies should be offered hydroxychloroquine to reduce the risk of fetal congenital heart block. This is also one of the exam question. Okay, so the exam question was, what you will give to reduce the chances of fetal congenital heart block? So the answer is hydroxychloroquine, HCQ. Normally we call it as HCQ. Okay, then how do you plan to for the birth? So the birth should be guided according to the individual obstetric factors, previous cesarean section, presence of preeclampsia, breech position, preference of the woman. Care plan should be documented before 36 weeks, okay? And anesthesia input, a care plan for the management of low molecular weight heparin, a plan for IV hydrocortisone. If a woman was on long-term steroids, why do we give IV hydrocortisone at the time of labor? Anyone? Hmm? Any idea? Any idea about it?
To prevent the mother going for adrenal crisis, ma'am.
Yes, mother and fetus both. Okay.
Okay.
Hmm. Okay. Good. So that's why, because we have to prevent, the fetus and mother from adrenal crisis, because long-term steroids will put, the additional, the stress on, the fetal kidneys and the maternal kidneys. So we have to give, the IV hydrocortisone to suppress, to prevent her from adrenal crisis. Then her birth should be, the planned Vaginal birth should be the mode of choice if possible. Cesarean birth should be considered for obstetric reasons. Women preference should be considered. And there is no contraindication for the use of labor analgesia, epidural analgesia. A hematology care plan should be there if a patient is on low molecular weight heparin, and it should be documented by 36 weeks. So, this is IV hydrocortisone. If continue their oral corticosteroids and when they are on established first stage of labor, add hydrocortisone IM. Consider a minimum dose of 50 milligram every 6 hours until 6 hours after the baby is born. This is exam question. Okay, that how long you will give, because the oral has a short half-life. However, the IV or IM can have a long half-life. For a woman having a planned cesarean birth or who have an emergency cesarean section with who have adrenal insufficiency or who are taking long-term steroids, so we can consider giving them 50 milligram if she has had hydrocortisone in labor, 100 milligram if she was not on hydrocortisone in labor, and further dose of hydrocortisone 6 hours after the baby is born. Because at all times we have to suppress the adrenal crisis. Okay. So to sum up, how do we give it? That we have to give at the time of labor and 6 hours after until the oral medications are going to be started, means the 6 hours after labor. Then postnatal care is also important. Breastfeeding should be encouraged. Medications, you need to look at that whether they are, compatible with the breastfeeding. Postpartum VT risk assessment should be done. Screening for mood and emotional well-being. Women should be assessed for comfort and confidence. Women should be followed closely by the rheumatology team, refer them back. And patients should be informed for the importance of preconception care again for the future pregnancy. Okay, so it means we have to talk to them regarding contraceptive advice, vaccination if applicable. Okay, so you can see that how this the beautiful small guideline, but many the clinical relevance the questions are there, and many the exam questions are there as well. So here they are talking about in this that what are the medications, for example, prednisolone, antimalarial, HCQ, sulfasalazine, methotrexate, and leflunomide, cyclosporin, tacrolimus, cyclophosphamide, mycophenolate, IV, the immunoglobulins. So multiple things. So many of them are not pregnancy friendly, as well as they are not, to be given in the breastfeeding as well. Okay, and then monoclonal antibodies these days, TNF alpha antibodies. So infliximab, etanercept, adalimumab, cetrolizumab, blah, blah, blah. Okay, so all these things are under consideration. So because all of them has, the prenatal exposure, it means they are going to be transferred through placenta to the baby. All right. So this was all about the cardiac diseases. Any question from this guideline or anything anywhere from the our session or for this exam? Anything? So you're welcome to ask any question. Saira, Iman, Saud, Noor, Rabia, and one is Samsung. Any question? Okay. Okay, Rabia, thank you. Thank you so much. Very good. All right. So any question, anything? So very good. No problem. All right. Because this exam just need a focus. This exam just need that the how you the go for this exam. You should know the syllabus, okay? You should understand how you are going to prepare for this exam, and then yes, go for it. All right. Brilliant. Thank you, Shalini. Thank you so much. All right, all right. Okay, brilliant. So, if there is no any question, so we can, conclude our session with this positive note that yes, if you want to go for this, the MRCPI March diet, so yes, go for it. Don't delay. Start your preparation. If you want, the focused preparation, focused, the material, so you can, take my help. You can join me in my, the paid classes. So yeah, there is going to be a good, the group. So we will start having, the good, the discussion on a day-to-day basis. However, WhatsApp group will be on and you can study over there as well. So this way, your syllabus is going to be revised, because once you will finish your syllabus, it needs to be revised as well. Okay. So yeah, all the very best, guys. If you guys need any help, any input or anything, feel free to contact. Okay, contact me, contact my team. So we will try to help you as much as possible. Okay.
Thank you, ma'am.
Thank you, so thank you so much. Thank you. Thank you so much, everyone, for your, the time. Okay. Good job. Mhm. All right. So yes, anyone who wants to join can join our, the team, can talk to me, Mehvesh, Noor, and our, the official team as well. So anyone who has any question can ask, or, they leave the message later on, or join us. Okay. Because we do try to prepare in a very friendly environment. I do try to give individual attention to every candidate. Our MRCPI September was a hit. We have had 100% pass result, okay, for our crash course. So, we have had a, the very good score. All right. Anyway, I will, try to make another session on any other important, the guideline or talk article. So you guys are encouraged to study. Schedule will be posted in a while. So start studying, okay? And
Excuse me, ma'am.
yes.
I do have one question,
Mm-hmm.
and it might be a stupid one
No,
at
no. No
the
question is
time.
stupid. Mm-hmm.
When you pass the MRCPI exam, the part two,
Mm-hmm.
the part two exam, do you still have to go through the GMC registration? Because they say it takes about a year and a half for them to offer the Ireland registration.
Ireland is a bit, the long process. However, GMC
Okay.
can be done. Okay. So if you finish your MRCPI exam on time, means the theory and the clinical both. And once you get your, the membership certificate, you can apply for your MRCPI. So it's a wise idea that if you pass your MRCPI theory, so right away, they prepare for IELTS or, the OET. So if you have your valid OET, so yes, the after this, you can straight away start your GMC process. And GMC process hardly takes 3 to 4 months, not more than that. Okay. However, Ireland is bit, the long process.
Thank you.
Welcome, welcome, welcome. Okay, thank you, Rabia. Thank you so much. Thank you so much. Okay, guys, I will see you around in some other session. So study hard, work smart, and don't look back. Just move forward. Keeping in view of your own circumstances, your own choices. So just the choose this exam as another opportunity to go forward, move forward, and to look for other opportunities as well. So I have one private message that can we work in Middle East? Yes. MRCPI has more weightage in terms of MRCOG in some of the Middle East countries, let me tell you. Keeping in view that it's the the oldest Royal College. Okay, so that's why. Yes, it is accepted by Pakistan, the PMDC as well. So it will be written on your PMDC certificate. Okay. All right. Okay. Fine. Thank you so much, guys, for your presence. Thank you so much for your attention. So I will see you guys somewhere, the around, I think, in 2 weeks' time. Okay? So take good care of yourself and your loved one. Bye bye. Allah Hafiz.
Allah Hafiz, madam. Thank you.